where should proactive patients who develop side effects like pneumonitis or resistance look for available clinical trials to discuss with their doctors? So I think that that's a great question. The best source, and I use it often, is a website called clinicaltrials.gov, .gov, and it really is a list of all clinical trials sorted out by different status. So some clinical trials are open but not yet accruing patients. Some trials are active and accruing. It tells you all the different sites that are accruing. It can be a little overwhelming because depending on what search function you use, it can come up with like 6 to 10 pages of different clinical trials. So that can be a little bit daunting. I think if a clinical trial if a patient is interested in clinical trials in general, I think it's great to always bring that up early with their doctor, so the doctor, can be maybe on the lookout for what may be available at their own cancer center, or maybe other trials are opening up nearby. I think that's probably a really good way to go about it.
Yeah, I'll just add to that. I think talking to your provider kind of at the time that you're thinking about changing therapies, talking about what is available at that institution. I know in the Bay Area, we have a pretty good pulse on what trials are opening and closing. It's a very dynamic process, and the eligibility criteria are always also very kind of specific to the studies. And so it's not uncommon when I see a patient and we have to decide on next line of therapy, I'll go ahead and shoot an email to my colleagues at UC Davis or UCSF. I'm at Stanford, trying to just make sure that I know what trials are available there and to consider those options. And yeah, as Angel mentioned, I think clinicaltrials.gov is great. But as she said, also it can be a little bit overwhelming, and then you're seeing kind of trials throughout the country, which may not be really practical or feasible. So really thinking about in the geographic region that you're in, kind of asking your provider to look into sort of the options, and then it's I would say it's fairly common for us to be sending patients back and forth to various institutions. Usually, if a trial is not open at our institution, it'll be open at one of our nearby institutions.
About just in general about how to treat mouth sores if you're on osimertinib, and if there's any nutritional supplements that can help. Maybe Dr. Das too, you can speak to this. I am not aware of any nutritional supplements per se. What has really helped my patients the most is really like the salt and baking soda rinses. It helps to heal the sores. And really, if the sores become too bothersome, we have had to dose reduce in those situations, and the sores essentially resolve. But I don't know if Dr. Das, if you've heard of any nutritional supplements that may be helpful.
No, I agree with you, Angela. I think our first line is generally the baking soda rinses, and they do usually take care of the mouth sores. And yeah, I'm not aware of like ginseng or fish oil being helpful in the situation, but I imagine there may be some nutritional supplements that may be marketed towards helping that. And so I think it's always important, if you do come up with something, to bring it in to your appointment, show it to your oncologist. In general, I'm pretty open to patients using supplements. As you know, they're just not regulated by the FDA, so we don't always have all the sort of information. But I think it's useful to look it over with your treating provider, and then as long as it looks otherwise safe, I think it's okay to go ahead and use as a kind of an adjunctive option.